Hi, it's me, Dr. Muhammad Kazafi, and you are watching Dr. Muhammad Kazafi Views. Actually, I am presenting one very interesting topic, not a case, it's a topic. And because recently I have been experienced that kind of case, and usually people are thinking it is only because of trauma, but it is not only because of trauma, it is because of multiple reasons. So here I want to present you a topic name is Raccoon sign, and Raccoon sign is comprise unilateral or bilateral progressive periorbital ecchymosis associated with edema. It is also referred to as raccoon eyes and the panda sign, and the pooling of the blood around the eye is the most commonly associated with the fracture of the base of the anterior cranial fossa. And the finding is not observed immediately following the injury and typically delayed by 1 to 2 days. If it present bilaterally, this finding is highly predictive of an anterior skull base fracture, and classically the tarsal plate will be spared in this condition. Further extravasation of the blood beyond the periorbital region is limited owing to the orbital septum inserted into the tarsal plate. So when skull base fracture is present, the raccoon sign is present in 50 to 60% of such cases, and the sign is reliable bedside clinical marker and usually associated with the anterior skull base fracture along with side with the image of the frontal and the orbital bone. So this is raccoon sign, and you can see here there is a periorbital ecchymosis and skull base fracture associated with this kind of raccoon signs. So I want to present here little more about that, and you can appreciate the raccoon sign like this also. Simultaneously, I just want to present here that the raccoon sign is present in trauma victim, and one should be aware of the following associated injuries and the complication. It harboring such a cerebrospinal fluid, injury to the eye, injury to the cranial nerves such as 1, 2, 3, 4, and 6, intracranial replacement of the nasogastric or nasotracheal tube, diffuse axonal injury, insult to the hypothalamic injury or hypothalamic pituitary axis causing endocrinopathies, maxillofacial injuries, cervical spine injuries, pneumocephalus, and later stage meningitis. So the clinical significance here, the various etiology behind the causation of the raccoon sign can be summarized as follows. And the traumatic minor event like the plucking of the eyebrow or the non-accidental injuries, thoracic trauma, and crush injuries following vigorous sneezing, coughing, or vomiting, probably due to the periorbital venous hemorrhage, and post-traumatic orbital emphysema due to the fracture of the orbital wall and entrapment of the air from the paranasal sinus. And the simultaneously, these were I just presented the traumatic etiologies in front of you, and such as the minor event like the plucking of the eyebrow, non-accidental injuries, thoracic trauma, and the crush injuries, and following vigorous sneezing, cough, or the vomiting, probably due to the periorbital venous hemorrhage, and the post-traumatic orbital emphysema due to the fracture of the orbital wall and the entrapment of the air from the paranasal sinus. Vascular subarachnoid hemorrhage, such as the following the rupture of an ophthalmic artery aneurysm, venous sinus thrombosis, and commonly secondary to the cavernous sinus thrombosis, giant cell arteries, trigeminal autonomic cephalalgia, benign intracranial hypertension, acute migraine due to the vasodilation and the release of the vasoactive substance include heparin. Infectious reasons also may cause the Raccoon sign, the severe pediatric adenovirus infection, periorbital leukoderma, frontal sinus mucocele, and the neonatal lupus erythematosus vasculitis may lead to facial and periorbital purplish red plaque, chronic atypical neutrophilic and dermatosis with lipodystrophy and the elevated temperature such as the Kendall syndrome due to the predilection to involving periorbital skin. Lichen planus pigmentosis and the hyperpigmentation due to the pigment incontinence and sweet syndrome are acute febrile neutrophilic dermatosis skin disease characterized by the sudden onset of a fever and the elevated white blood cells count, tender red well demarcated papules and the plaques that shows dense infiltrates by neutrophil granulocyte or histological examination. Raccoon sign in this condition result from the secondary vascular damage caused by the prolonged exposure to matrix or metalloproteinase, and the toxic products of the neutrophils in the infiltrates may be responsible for vascular damage leading to the erythrocyte extravasation. Metabolic, the amyloidosis, most commonly light chain, and AL type is due to increased vascular and fragility resulting from the amyloid deposition, and this is one of the most common cause of the Raccoon eyes other than trauma, and the finding presence in about 1/5 of the patient with amyloidosis. Myxedema also can cause the Raccoon eyes. Now, definitely when you are listening this, definitely I know you know that, but definitely you are feeling little strange that the Raccoon eye is very much specific for the skull-based trauma, skull-based only trauma, but not only skull-based trauma. Yeah, because of the skull-based other disease which can cause the Raccoon eye simultaneously. And here the malignancy such as the hematological malignancy, the blastic, plasmocystic, dendritic cell neoplasms, lymphoblastic lymphoma, and the acute amyloid leukemia, metastatic and neuroblastoma secondary to the tumoral obstruction of the palpable vessels and the neuroblastoma observed about the 6% of the cases Raccoon eyes. So it is little strange that it's an information for a lot of people here that the metastatic neuroblastoma secondary to the tumoral obstruction of the palpebral vessels and the neuroblastoma observed in the 6% of the cases, and the orbital metastasis of the solid malignancies. Kaposi sarcoma, simultaneously multiple myeloma, infiltration of amyloid proteins in the capillaries lead to increased fragility and which can burst under minor stress and usually painful. So the genetic reasons also there, the hemophilia can cause the Raccoon eyes, and the iatrogenic or perioperative Raccoon eyes usually observed among the patient with the systemic amyloidosis of the AL type and post rhinoplasties due to the bleeding disorders and the post endoscopic retrograde cholangiopancreatography ERCP, and they are doing in the prone position sometime, and consumption of the steroid and the Valsalva manures might cause increased venous pressure, which in turn lead to the rupture of the fragile orbital vessels in the elderly male. Here, if a nurse encounters a patient with the Raccoon eye, they should immediately ask the patient without a history of the trauma, CSF rhinorrhea, or visual difficulties, one should avoid inserting a nasogastric tube in such a patient as inadvertent and intracranial misplacement may occur, and it is better to place a orogastric tube instead of the intubation if necessary. So the periorbital ecchymosis and persist and resolve within 2 to 3 weeks and following spontaneous gradual degradation of the blood products. So that's all for this topic. I just wanted to present the raccoon sign can present for the multiple reasons, not only because of the traumatic skull base fracture. I hope you like it. If you like it, share it and subscribe me. Thank you so much and see you soon with the new topic.